Okay, thank you very much. All right, so I'm going to take, sadly, the focus away from UBC and the farm. I love the farm, which is pictured in the background there. And this is the city of Vancouver, where in 1996, the 11th annual International AIDS Conference was held. And if you didn't know our city had this distinction, this is where they announced the cure for AIDS. That might surprise you. It's not really the cure for HIV, which is the virus that causes AIDS. Nevertheless, it transformed HIV from a death sentence into a treatable disease like diabetes. These are antiretroviral drugs, and these are the drugs that are responsible for this life-saving transformation of this virus. So your experience of having this virus is a lot different, however, if you live in the west end of Vancouver versus a shantytown in South Africa. This is Khayelitsha outside of Cape Town. And so what I want to talk to you about today is this sort of global divide and two different worlds in terms of access to healthcare and medicines that are really important to that. And kind of I'll get back to UBC eventually to what you can do about it as a student or faculty member here. So more than 30 million people in the world have the HIV virus. That's a lot of people, a big number to try to grasp. So I'm going to focus on the stories of two individuals to kind of give you an idea of what the impact can be. So this is John Finley. He's my upstairs neighbor. And this is a picture I took of him a couple of days ago in my house with our backyard there. And in our backyard this summer, he actually, as I was getting to know him, he talked about how in 1997 he was in St. Paul's Hospital dying of an AIDS-related lymphoma. He's got HIV, and he had this essentially terminal cancer that was a result of the knockdown of his immune system. However, because this was a year after antiretroviral therapy was available, John is still alive, and I got to meet him and know him. And there's a few other things that maybe you could learn about John. After he recovered, he got an MA in creative writing. He wrote a screenplay, all right. But now he actually runs a $12 million international fundraising business, like those Amnesty International fundraisers all over town. That's kind of his business. He's got 450 employees in about 3 countries worldwide, 5 different companies. Anyway, so he's clearly able to live his life in good health, contribute to his community and really the world community with his social enterprise, and most importantly, to live with dignity. And so that's John. And this is Joseph Jun. He also has HIV. Now, Joseph clearly is in a different situation. He lives in rural Haiti. He's not going to get any better because no one's going to give him the drugs that John has access to because they cost $15,000 per person per year. And as Duggan pointed out, a lot of people live on less than $1 per day. Joseph probably doesn't make much more than that. So no one's going to help him out. And so this really, another important feature of this picture is that you can see there's actually a nurse there in the background. So Joseph's actually, part of the reason why people don't have access to medicine is they don't have access to healthcare at all. But Joseph's actually in a clinic, and he doesn't have access to the drugs, but he could get them. But he just can't because they're too expensive. I'll tell you a little bit more later about what's done in Joseph's case, but I want to talk about why the drugs are so expensive in the first place. This is because pharmaceutical companies make the drugs, and they own patents on these drugs. The patents represent control over what the prices can be. There's good reason for that, because drug companies have developed these life-saving treatments, and they should be rewarded for that so they can continue to make life-saving treatments for everyone. This is the pharmaceutical industry expenditure, a total of about $3 trillion in the last decade. About 12% of that, an astonishing amount of money really, like $300 billion over 10 years spent on research and development for treatments. So that's quite substantial. Operational costs, every company has those, marketing and administration, which is important in some way, and 25% profit. And just to give you kind of an idea of what 25% profit means, not only is it double what they spend on research and development, and marketing, I guess, is a substantial portion of that as well. But John was telling me his business, although it makes a lot of revenue, is not very good. They only clear about 3% profit, and we're not a very good company, he says, whatever. But he'd really like to make 10%. A company making 25 is doing amazingly well. And an industry that makes 25% is not too surprising that they are the second most profitable industry in the entire world. Now, getting back to Joseph, because he doesn't have access to these treatments because they're patented and the price, sorry, I should say a patent is the legal right to exclusively manufacture and sell something so that you can recoup investment costs. But Joseph, they're not making any money off of him anyway, and so the medical staff here will basically give him palliative care, which just means they'll make him comfortable while he dies of a treatable infection, which is enough to make you angry. But this story, which is actually done, is that Joseph is given a project. One of the staff members will give him this memory book where he's able to, I guess, write, if he's able to write, or with pictures or whatever, pass down knowledge of himself to his children so that they can understand something of who he was and something of the advice that he would have given them had he been able to see them grow up, which he won't be able to do because he's going to die of this infection. And I don't know this man, so I don't know what he's going to think about while he dies, but I know he's going to leave his children behind, and that's just the way things are. And what can be done to change that? One point that someone like Joseph, although not in Haiti, but in South Africa, raised, thanking the medical staff for helping him. He said, you know, you bring your kindness here. You don't have to, you're a volunteer. You bring your kindness is good, but it will not cure this AIDS that I have. But I know that there's medicine for people like you in your country, but why here is there no medicine for people like me? And this was a really very clear, penetrating way of explaining the reality of a world where medicines are out of reach of poor people. And that is that it is acceptable for you to die of a treatable infection just as long as you're poor enough. Now back to Haiti and Joseph himself. Dr. Paul Farmer founded a clinic in rural Haiti to treat people like him, which is where he is right now. And he said, actually, no, I don't think it's acceptable for someone to die of a treatable infection. In fact, I think that's bullshit. So I'm going to go to my hospital in Boston, where I'm a respected infectious disease specialist, and borrow antiretroviral drugs to treat people like Joseph. And this is the impact that it had. This is Joseph within 6 months of antiretroviral therapy, who's amazingly restored to health. I've seen this picture so many times, and it still makes an impact. You can see that his life is completely transformed. He not only has his health, obviously, but he's able to contribute to his community. He's able to raise his family. His children get to know him. And importantly, he's able to live with the kind of dignity that any of us would expect for ourselves. So this all comes down to access to these treatments, and this is Médecins Sans Frontières, Doctors Without Borders, widely respected humanitarian organization that won the Nobel Prize several years ago. And these are the antiretrovirals that I thought, let's just be systematic about this problem. Let's talk to the drug companies. They're not making any money in South Africa anyway, back to South Africa, because that's where they're working. So they tried for 12 or 18 months, all these negotiations to try to bring the prices down, and it just didn't happen. The pharmaceutical companies weren't interested. They were interested in their bottom line, which I guess is understandable. That's what they're paid for. But they made a real decision there. Well, if the laws are keeping us from importing drugs, we're just going to have to break the laws, because it's more important to do that than to let our patients die. So this is the shanty town of Khayelitsha where they were working. And they, with a group called the Treatment Action Campaign, they imported generic versions of this drug, which were available at a far lower price. And they were able to start treating people in their clinics. And this is a really important turnaround. And the story in Haiti as well proved that you could really treat people who were living in poor conditions for the HIV virus with antiretrovirals. And at the time, it was kind of, it's hard to imagine, but they said, you know, well, these people they don't even have wristwatches. They don't even have running water. How are they going to know when to take their drugs? Like, let's address those concerns first, and then, like, you know, we can talk about giving them therapy. But Médecins Sans Frontières and Partners in Health, Paul Farmer's organization, both kind of broke that kind of paradigm and really changed the world.